Well, let's find out more about the risks posed by this dengue fever outbreak. We can speak to Antoine Flahault, who's an epidemiologist and professor of public health, who joins us now from Geneva. Thank you so much for joining us. Professor, is it correct to refer to this dengue outbreak as an epidemic?
Yes, for sure. It's not an endemic disease. It spread by outbreaks. And currently we have a huge outbreak in Latin America, but also in Caribbean islands. And it has started a couple of weeks ago, and it is really bursting now, much higher than the last epidemic, which was in 2020.
And what are some of the causes? What would trigger an outbreak like this?
In fact, the cause is a mosquito, because it is a mosquito-borne disease. It's not transmissible between humans. It needs a mosquito. So when the climate is favorable for the mosquitoes, particularly in the warm season, it's still summer in the south hemisphere, and in tropical areas it's always warm, but sometimes it's flooding, or sometimes the meteorological conditions are prone to trigger such an epidemic.
Okay, what does the disease typically do to people? What are the symptoms typically of dengue fever?
Your documentary was quite precise here. They say that for most of the people, it's a benign disease, but for a small proportion, maybe 1%, may go to the hospital because of a severe form. It may be an hemorrhagic fever. And usually in good facilities, in modern hospitals, it's more or less easy to treat them, but sometimes, unfortunately, it may come to death. So there are some complications which may lead to death.
Okay, and in terms of protection against the disease, I mean, what exists by way of methods to prevent it, and also by way of a vaccine?
So the vaccines are not promising research and development of new vaccines, particularly in Brazil. But currently, the existing vaccines are a bit disappointing. But you can always fight against mosquitoes, because if you are not bitten by mosquitoes, you will not have dengue. But by fighting against mosquito is probably easier for tourists, because you can put repellents. But of course, when you live in tropical areas, you cannot put all along the year repellents. And sometimes it's more difficult. So we need to fight against mosquito, because these mosquitoes are almost domestic mosquitoes, if I can say that, because you grow them in your garden, as it has been said in the documentary, at the bottom of pots and flowers. So we need to fight against shelters for mosquitoes, not to grow them in your garden, in your balconies.
Okay, so people can play a part in trying to make sure that the mosquitoes aren't there to begin with. Will they eventually go away? Is it seasonal? And therefore, when temperatures drop, and I don't know whether humidity plays a part as well, but when the hot season comes to an end, does that therefore bring about an end to the risk posed by dengue fever?
Yes, it's a good question. It is. For sure, it is bursting with outbreaks, and it is favored by these hot seasons. Of course, in tropical areas, sometimes you may have all along the year the risk of these outbreaks. In more temperate zones, in Rio or in Sao Paulo, they have experienced a winter season, which is not as cold as in Paris or in Brussels or in Geneva, but it is cooler. And at that time of the year, meaning in July and August, usually they do not experience these outbreaks of dengue fever.
Okay, well, thank you very much indeed for taking the time to speak to us. Professor Antoine Flahault in Geneva, thank you very much indeed.
Thank you.